This is Denise Nugent, known as Dr. Denise.
And this is Dr. D, and we both practice family medicine.
So our first topic today is going to be anxiety, because the same day that we were talking about this idea of having a video to talk about some of the things that we wish we had more time to talk about, I had seen 4 patients that day with anxiety, and it is an increasingly common problem. And you see it quite a bit too.
I was so surprised. You know, I practiced in other locations prior to Orange County. Mm-hmm. And when I moved here, I said to myself, oh my goodness, there are so many people with anxiety here, so many people that seem to be requesting or requiring something to help them with stress. So
right, and the United States is known as the most anxious country in the world.
Really?
Amazingly enough, yes. You would think with our prosperity and general safety on the streets and stability that wouldn't be the case, but it is. The more developed the country is in general, the higher the stress levels are.
Okay.
And in Southern California, we see a tremendous amount of stress. We see it when we go to Starbucks, and if I were to make the mistake of hesitating with my order, someone is usually going to tap their foot or sigh, because I've held them up for 2, maybe 3 seconds. Same thing with traffic stops.
Do you think it's competition? Do you think that is something to do with what's behind this?
I think there's tremendous competition. I'm speaking more just from our framework in Southern California, and it is. I really feel like it's different from Chicago. Chicago was a little bit more relaxed, even though it was the city that works. Here, I think people feel a lot of pressure to compete, starting especially around 2008 when we had the Great Recession. A lot of people were laid off. A lot of patients told me that they had the impression that if they didn't work as hard as possible, that their job would be lost or somebody else would do it, and so they started doing the work of 2 people or 3 people, and that has not eased up a whole lot over the years.
Right. I did notice a difference then too. Mm-hmm. I would hear those similar stories. And then, there's been enough time passed since then for those people to pass it on to people in their family, their relatives.
Yes.
And that's one source of it as well. If your family is a family that doesn't do well with new information or tends to react with some fear or anxiety when things change, then that's a pattern that probably just keeps on in your family.
Right, and I think it can become passed down. A lot of people have gotten it honestly from their parents, either from lifestyle or perhaps from genes, but also chaotic upbringings can contribute to it. I'm seeing patients who are having young children who are feeling the anxiety in our culture and from their parents. So it can definitely be passed on.
Right.
It can become a lifestyle.
And we're not really trying to be exhaustive in each of these.
No.
We're not trying to say like all the reasons or all the treatments. We just want to discuss it in a way that might possibly be helpful for some of the people watching.
Right. In I think both of our practices, I find that anxiety worsens a lot of people's illnesses. So even though people may come in with insomnia or backache or other problems, it does affect their lives. And so being aware of how much stress is in your life can really help you to get better in other ways too.
Right. As a matter of fact, way back in medical school, we had a course about this sort of thing, how anxiety, changes, and there were certain diagnoses that it particularly attacked, like asthma, for instance, that people get a lot more anxious with breathing problems, and then with anxiety, the breathing problems seem more anxious, is more pronounced as well. So, what are we going to do about it? We have 15 minutes with the patient. What are we going to do? Are we going to be able to find out how their family handled things? We're going to be able to equip them with all kinds of ways of coping with these things. What are we going to do for the patient?
We are detectives, and it's different for every single patient. It really is. So we get to be good detectives.
Okay.
Yeah? So it usually depends with what people present with. If they're presenting with other symptoms like a backache, and then they mention that they just have been working long hours at work or something like that, that makes me ask about work. If they say that their kids are driving them crazy, then I start to ask about the kids. If they're not sleeping well, then I start to say, are you worried about something? Is there something else, affecting you? So we do try to suss it out. And it really is worthwhile to just talk to somebody else who can be a good friend or a professional. And then you can kind of sort out what's really going on.
So counseling is a good place to start.
Counseling is an excellent place to start. People may not realize this, but there's a therapy called cognitive behavioral therapy. And it is not the kind of therapy you might picture from TV shows or movies in which people lie on a couch and talk for years. This is a very practical kind of therapy. Most people experience significant improvement in anxiety and depression in 6 to 12 weeks. It's not a huge investment of time. People learn skills that help them not to be anxious in the future. And you're really learning how to do your own stress management.
Good.
So that's one of my favorite therapies. But your doctor may have access to other therapies too that we probably can't go into today. But that's one of the good ones right now.
Yeah, yeah. Mm-hmm. So of course we think first of all of counseling as far as therapy is concerned, and then of course we think about medications. So a lot of people kind of say, I don't want any medications, and they'll go along a long way with a lot of anxiety still, with heart palpitations and shortness of breath and
so
panic
many
attacks,
symptoms,
because they really distrust medication so much,
Right, and it's such a shame because I think that anxiety tends to fuel itself. The more adrenaline we have over time, the busier we feel, the less time we feel we have to take care of ourselves. It tends to get worse. And about half of all the patients that I see with anxiety have depression also. And so we might have been able to prevent some of those problems by seeing them sooner.
Mm-hmm, mm-hmm. Well, there's two ways we can go with medications.
That's what I was just going to ask you. What do you like to do in terms of medication?
Well, I really like to have somebody on some just really small amount of SSRI, serotonin reuptake inhibitor. Those are also antidepressants. It's the same thing. And a lot of people say, oh, antidepressants, but really I really don't know why they say that. Okay, do you have any idea why antidepressants got a bad rap?
I don't either, because I think a lot of the stigma is gone.
Yeah.
Taking these medications.
When Prozac first came out, it was the first SSRI that really...
It was revolutionary.
Right, it was revolutionary. But since then, there's also been many sisters and brothers and cousins of Prozac come out.
Yes.
That are some similar, some somewhat different. But the idea behind these medications is you take a small amount daily, whether you feel like it or not, whether you're anxious or not, whether you're depressed or not, that moment you take it, and it grows. It doesn't grow.
Well, it's cumulative.
Cumulative.
Right?
The effect is cumulative inside you, so that you're able to handle things a little better and a little better slowly as time goes on.
Yeah.
One day you wake up and, gee, I drove all the way to work and I didn't have a panic attack.
Right. Things like that. So
you should feel like yourself. If you don't feel like yourself, it's not the right one for you.
Right, and no one has to be stuck on something they don't want to be on.
Exactly.
Right? If it's not working well for them. I don't suggest medicine first off. It really depends how much the anxiety is bothering them. If it's really interfering with their life, it's interfering with work, their relationships, their sleep, their enjoyment of life, then I think it's time to consider it. Should I tell my Provence story?
Sure.
Okay. So my husband has a French background, and he says that in the United States, we don't have enough time to take care of the stresses of life. And that if you were very anxious and stressed out in Paris, you would be sent to your aunt's house in Provence, and they would feed you good food for 3 or 4 months, because that's how much time they can take. You would work in the garden, you would argue politics in the local cafes, you would restore yourself, you would get perspective on your life, and then you would return to your work with just a stronger person who has new skills. But here, you're lucky if you get 3 days off from work, and so we use Prozac. It's the American way. And yes, we do think that you should use other modalities, but when people are suffering, I really like to start people on medicine right away and not say, let's try exercise first or things like that. Sometimes people don't have the energy to do those good things for themselves because they are so stressed. Once they have a few weeks of Prozac on board or something like that, then it seems very possible for them to do other things to take care of themselves.
Right, right. So if you are saying that you're going to do other things, in a way it's saying pull yourself up by your bootstraps.
Right.
And we're going to help you with, improve your bootstraps, etc. But really, in order to, wouldn't it be nice if you actually had a little bit of calm in your life, a few unanxious days, that you were able to figure out how to cope with whatever it is, the mother-in-law, the family member with terminal illness, or whatever that is, sometimes, or very often, when people come in to see us with anxiety or depression, there is an event that made them decide to come in at that time, or a change in how they were handling things. And relationship, you always kind of think of, okay, what relationship has this got to do with it? Is it the husband who left? Is it the child who's sick? Or
the financial disaster.
the parent who died, or something like that. So at those times, you need a little more, I call it emotional underpinning, which is you can get through an SSRI, like a small amount, and it doesn't mean you have to be on it forever.
Right. I know I tend to say right a lot, but you are right. So what is, so how long do you usually have patients on an SSRI?
Oh, that's really individual, very individual. Yeah. To complete that whole little picture, though, people often say, "Oh, I don't want to be on that all the time. I just want something I can take here and there, just when I'm feeling
How many times have I heard that?
Just when I'm feeling anxious,
I just
or my
want to take
heart's
something when I
palpitating."
need it.
Well, tell me about that.
So a lot of times patients have done some research, or they have a friend who's given them Xanax or lorazepam, or they've given them any number of things that relax them short term. They say, "That's great, that's all I need." Those can be highly addictive, and the favorites are the most addictive. And it causes a terrible feedback loop, because if a person feels very anxious or is worried about having a panic attack and they take a pill, and within a few minutes they feel good again, that's an incredible reward. And so that reward tends to reinforce itself until the person is doing it over and over and over again. And it's a great way for people to get addicted.
It's an addictive cycle.
Yes. So I often start people on two medicines. I give them a longer acting benzodiazepine, like clonazepam or something like that, because it's a little less addictive. And this is just to make them comfortable during the 3 weeks or more that they're waiting for the Prozac or the Paxil to work and all. And then we usually plan on the Paxil to, we tell them to expect not very much for the first 3 weeks. And then to start noticing, it's almost like turning on a light switch. One day, those receptors have plumped up and are working again with the serotonin, and suddenly stressful things don't seem as stressful like they used to. So we reevaluate them at 4 weeks, sooner if they're having any side effects. And then if they're doing well, we encourage them then to explore other modalities to help them deal with stress. And the general plan is to revisit it at 9 to 12 months. And I don't like people to stop sooner than that, because there's some very good research showing that we are training the brain to act more like a normal brain. It's not just covering up symptoms. That when we give patients Prozac or Paxil or something along those lines, the brain is going to hang on to its serotonin, and all the adrenaline, the epinephrine is going to be kind of pushed aside. So it's going to act more like a normal brain. And they've done PET scans that show this, that brains actually will change and look like a more normal brain after 3 weeks on Prozac. And that 80% of the time when people go off of it, the brain continues to look normal. So it doesn't look like an anxious brain again.
What does a panic attack feel like?
Well, I've been talking a lot. How about you tell us about a panic attack?
Okay. Okay, so we have people coming in saying, "I've got this chest pain. Oh my gosh. It's either sharp or it's dull, or it's a 21 or 22-year-old person that thinks they're having a heart attack."
Yes.
And this is, extremely unlikely. And it comes with feelings of anxiety, and sometimes they'll tell me they get numb around the mouth, or they get numb in their fingertips, or even their toes. Sometimes they have a feeling of panic, that they have to get out of this room. shortness of breath.
It's a horrible feeling to have. You see people describe it, and it looks like they thought they were going to die.
Yes.
Just horrible. And once someone's had a panic attack, the chances of having another one do go up, because now the person is making a lot of adrenaline and the body thinks it's protecting itself.
Right. So this is a discharge of adrenaline. It's like all of a sudden a bear just came in front of you, and all this adrenaline comes out, and it's fight or flight. And flight is usually what we want to choose in this case. And so all those things that help you to run away really fast in your body are happening.
Exactly. Exactly. And there are different kinds of therapies that can also help people learn to control panic attacks, to head them off, things like that. But supporting them with medicine, if it's interfering with their lives, is a wonderful idea. I rarely have complaints of side effects, and if we do, we can change the medicine.
Right. Right. So that's a good point, though, and that means that, for any of these things that we're talking about in the future as well, follow-up is key. So we do see people that have gone to see one doctor, and they'll say, or for one visit, and they'll come and they say, well, that didn't work. And I'll say, oh, okay, well, how many milligrams did you take? For how long did you take it? Well, I took it for 3 nights, and I had to go to the bathroom all night. Well, there's a lot to these things. First of all, deciding to yourself, is this a side effect, or is this a coincidence of something that happened to be getting a bladder infection at that time? We do trials of thousands and thousands of people to decide what side effect is not because of chance, amongst these people. So it's hard to determine with one person in just a couple of nights. So follow-up is important. Go back to the doctor, make your complaint, say this felt like this, this didn't work, I didn't like this, and then let them get their bag of tricks out and see what the next thing is that we're going to do to help you, because we don't have just one thing.
Exactly. Yeah. So it's treatable, it's very treatable, it's surprisingly common. There may be somebody sitting in a cubicle next to you or at a desk near you who is suffering from anxiety, and it's making something else worse in their lives. And I think that as we have more awareness about the problems of anxiety in our society, we're going to be able to help each other more. It never hurts to go to the doctor and get it checked out.